Heart disease is a little like car trouble. It's a big term. It refers to a lot of different things, and the car is a complex machinery like the heart. So the heart has four parts. It has the pumping part, the muscle. It has the electrical system that provides the stimulus to beat. It has the muscle itself, the valves that keep the blood going in one direction. And it has a set of arteries, the coronary arteries, that bring blood to this muscle that is working all the time, even when you sleep. And heart disease in general refers to disease of the arteries, but there's valvular heart disease, there's electrical heart disease, there's disease of the muscle of the heart, which can get infected, say, by viruses. It all is heart disease, but in general, because it's so much more common than any of the other heart diseases, coronary artery disease, or atherosclerotic coronary artery disease, the buildup of cholesterol in the arteries, is by far the most common form of heart disease. Well, atherosclerotic coronary artery disease, that sort of heart disease, the most common, is the leading cause of death in adults over 35 in the industrial world. So this year alone, in America, there'll be 1 million heart attacks. It's estimated that more than 50% of men and nearly 40% of women will have atherosclerotic coronary disease problem before they die. So that's a huge number. There are a couple of important risk factors: smoking, diabetes, kidney disease, high blood pressure, elevated blood cholesterol, and very importantly, an immediate family history of heart disease. So these are cutaways of a progression from a disease-free artery to an artery that has a little bit of yellow cholesterol buildup, to an artery in which the plaque, the buildup of cholesterol, has started to erupt like a pimple, causing a blood clot to form in the artery, and finally to an artery that's totally blocked by clot. And that's what happens with a heart attack. A heart attack, once it starts, has about 2 hours before all the heart that's fed by the artery that blocked dies. The time element is so critical that the American College of Cardiology and the American Heart Association makes it a primary goal for a heart center to perform an angioplasty within 90 minutes of a patient's arrival at the emergency room if they're having a heart attack. This is hard to do. There are 8 or 9 staff members that have to be assembled. The equipment has to be geared up, especially if it's 2 in the morning. That's not easy. But we do it, and in fact we do it more than 90% of the time. Well, we're always trying to discover people with heart disease earlier and earlier. And in general, cardiologists are succeeding because deaths from heart disease are going down as a proportion of the population, but not by as much as we'd like. It's something that we have to keep working at, both from the clinician's point of view and from the general education of the population of America and the world in terms of diet, lifestyle, exercise, and all that.